Okay, this is part 2 of my open heart surgery. What exactly I had was a aortic valve replacement and an aneurysm repair. And I haven't even gotten to the part where I found out I had an aneurysm, but I'm getting there. So I ended where I had spoken with the doctor after my hospital stay, and after talking to the eye doctor, that both the hospital and the eye doctor were pretty sure that this had to do with my aortic valve and that I needed it replaced. It also, the other symptoms that I had that I talk about in the first part was the dizziness, I had swelling in my feet, I lost my eyesight in my right eye and the upper part of my right eye, and fatigue. And those were the symptoms I had for about a year that I did not know they had anything to do with my heart. So anyway, I got from that heart doctor, I was able to go see a surgeon. And I got in very quickly, actually, within a week. So the next week, I was able to see this surgeon. And when I went in, the things that I had researched, I assumed that he would, because I was 54, that he would suggest a mechanical valve, because most biological valves don't last as long. And so I just assumed going in that it would be he would recommend having a mechanical valve. And I also knew through researching that I was going to have blood thinners the rest of my life and perhaps be annoyed by the ticking sound of the mechanical valve. So but I thought, I can handle it. I can do this. And so when I went in there, I was surprised. He was an older doctor. I'm old, but he was a little older than me. And he was very knowledgeable. He was a surgeon that also helps teach other surgeons. And he said, I have a really good, a really good valve here that's not mechanical that I recommend for you. And studies have shown that people have had it for 19 years and plus, and it's still going strong. So, and it was called the Medtronic Freestyle porcine valve. So it was a pig valve, and I just talking with him, to be honest with you, he had me sold. And also, I didn't have to take any medication other than a baby aspirin afterward, and maybe blood pressure medication if I needed it. Who knows what was going to happen with my heart, because it was just about ready to get cut up and rearranged. So I was actually really excited about it. I was nervous about seeing this doctor. He answered all my questions that I had. I went in there with a list of questions on paper, and I was in one of the videos I watched, someone recommended it. I recommend anybody else do it. If you are meeting your doctors and your surgeon for the first time, have the questions ready. He did sit down and answer every single one of my questions. And I felt really comfortable with him. And we left there. My husband and I left that meeting and with him. And I was so happy. And I was really on cloud 9 happy. And we went and ate lunch. We went to go pick my kids up. This leads into me going to the hospital. So we're picking up my kids. And on the drive there, I am experiencing a pain under my rib, kind of. And it's growing. And I think I just have a cramp. I'm trying to just wiggle around in the van, stretch my arm out. And it's on my right side. I'm not even thinking it has anything to do with my heart at all. So it's just on my right side, kind of under my rib. And then while we're driving, we're getting close, and I just telling him, I'm getting really uncomfortable with this. This thing is not going away. This pain under my rib. And so it's on my right, and he gets out to go get the kids inside. And I'm sitting in the van, and it's growing. It's now moving from under my rib into the very center of my chest. And now the pain is going from the center of my chest right here all the way to my back. it's going directly straight through me, and the pain is unbelievable. So I have my phone in my hand, and I hit 9-1, and I thought, if this thing gets any worse or I can't breathe or something, I'm going to hit the one more time. And I think I'm having a heart attack here. So sure enough, it starts to grow, and I hit the one, and I open my door, and I start running into the building, and my husband's looking out of these glass doors and sees me running toward him. He runs out to me. I hand him my phone, and I said, I think I'm having a heart attack. He talks to the lady. They get there with the ambulance, and by the time they got there, the pain is gone, of course, and I'm just sitting there and in a room, and they're checking me and doing the EKG, and the head paramedic said, your EKG is not normal. You need to go to the emergency room. You can come with us, or your husband can drive you. And he goes, you're not actively having a heart attack right now, but you should go to the hospital. So I had all intentions of telling him that I was going to go with my husband and not just go home, because I was just embarrassed, like maybe I just had indigestion or something. So he was insistent that I call my doctor in front of him. So I don't know what he was seeing on the EKG, but I knew it wasn't normal because my valve was bad anyway, so I knew it wouldn't show completely normal. So I did call my doctor, and he said he was in the hospital doing rounds and to come in. And I said, okay. And I hung the phone up, and I signed some paperwork for the ambulance, and they left. And when I got my husband alone and we were driving in the car, I said, I think I want to just go home. I think I'm fine. Well, we were maybe down the street a block or two, and the pain in my chest started coming back. And so I just said, let's go back to the hospital. Sorry, there's something wrong. So we went to we got admitted into the emergency room area, the triage, and they did a CAT scan with my hands over my head, which I hadn't done that one before. And when they came back, he said, the ER doctor said that I had an aneurysm. It had not shown up before, so I'm thinking the pain that I was feeling was the aneurysm, and I'm grateful that I did go to the hospital and that the aneurysm didn't burst, because otherwise I probably would not be here. So that was a Thursday. That Friday, the surgeon came to the hospital to see me, and he said it was a holiday weekend, by the way. And so I'm thinking, I'm not going to have surgery until Tuesday. I should just go home. I'm not in any pain. I'm fine. They can't do anything. And so when he came in, he said, we're going to do this surgery on Monday on the holiday. And you need we're going to get this done. So that was a little shocking. So over the weekend, Saturday and Sunday, they did all the tests that they need to do. They did the test where they go up vein in your leg or something, and checked my whole heart. I'm trying to think of angiogram, and checked my whole heart, so that since they were going to go in anyway and have open heart surgery, they figure since they're in there, they'll fix anything that needs to be done. So anyway, my heart looked really good. All my vessels and everything looked great in my heart. It really was just my valve and the aneurysm repair. So on Sunday, this gal came in, and she was in charge of the respiratory system. So she was in charge of the breathing. So she had me do a couple tests where I breathed into things and to see how my breathing was. And one of those that you suck in the air and see how high you get the little blue thing to go. So mine, I could take it all the way to the top. It was like 2,500 something. And while she was in there, she's like, oh, good, your lungs are good. You're ready for the surgery. She said, do you have any questions? And in all the research that I was doing on this open heart surgery, the one thing that kept, the most thing that was bugging me the most was not being on the heart lung machine. It wasn't having my heart open. It wasn't stopping my heart. It wasn't any of that. It was waking up, being intubated. There's no way around it. You have to wake up being intubated and show them that you can move your diaphragm by itself. Because you're on the heart lung machine, you have to be able to open up your lungs by yourself with the with your diaphragm, and you can move it yourself. So anyway, and also there's blood work that has to be done before you can get off the being intubated, which I didn't know anything about. So she said, don't worry. She said, tomorrow I am on duty at the ICU. So I will see you after, and it's not going to be bad at all. And she was super encouraging. And she goes, we're going to get you off that intubation so fast that you won't even remember it. You'll be in this twilight state with medicine, and you will probably not even remember it. And so she was very super sweet, super helpful, and because it really was the one thing. And she also told me that I was nervous about how my hands strapped down, and that feeling of wanting to move my hands and touch something, and also having saliva going down. I had a bad incident with one time getting a root canal. So I choking on saliva. So I was nervous about that. And she said, well, I will let you use the suction tube and use it with your hand, and you can suction out all that stuff. So it really made me feel good. I feel like, wow, she really was the answer to a prayer, because that was the one thing I was worried about. So the next day I went into it really with a positive attitude. The surgery, I had no reason to not. I really felt good about it. I felt like it was going to change all this situation I was in with having all the issues. And so the next morning, on Monday morning, went in for the surgery. And because it was a holiday, there was nobody in there. It was crickets. And there wasn't even lights on. We had to turn the lights on just for me to have surgery. And there was about 10 people in there by the time we had the surgery, and they were all there just for my surgery. Nobody else was having surgery that day because it was a holiday. So I talked to everybody, the anesthesiologist, and just all the other doctors that were helping, and nurses. And the last thing I remember was, before the surgery, was just scooting over to, in the hospital, in the surgical room, scooting my butt over onto the table, and the anesthesiologist asked me to count backward. And so that was the last thing I remember until waking up. And I'm at 13 minutes right now. The waking up part is a whole nother story that was really painful. So I'm going to talk about that in part 3. And see you then.